I'm Dr. David Beaulieu, and I'm back with more news you can use. Normally, you're used to getting information from me, but today, as our office and center has expanded and we've started putting on more people to serve you better, one of the people that we've added to staff is a Dr. Susan Anschutz. She's a graduate of Cleveland Chiropractic College. She's a multiple degreed individual, and she has a number of specialty areas. She's been through the chiropractic internal medicine classes. She's going to handle the physicals that we need to do from our office. She's going to handle the lab work that we need to do, but she's also, and I think this is really important, she's going to handle the chiropractic. You people have been asking me, why don't you get back into chiropractic? Why don't you do that as well as your nutrition and your allergy work? Chiropractic is so important. Well, I really haven't done much of that since I quit the first time back in 1987. But Dr. Anschutz does work in that area. She's one of the few doctors I trust to take care of me. And we're going to talk to you a little bit today about the way she approaches that and some of the specialty things that she's done in her office in Lee's Summit, which is going to become a second essential care center. The first one, of course, being in Mission, Kansas, on Rowe Avenue, my office. We'll be talking to you about hyperbaric oxygen and a few other things. But let's start with chiropractic, because I think that's really important, Dr. Anschutz.
Absolutely.
You use an activator.
Yeah.
Tell us, what's an activator?
An activator is a tool developed. The technique's been around for about 50 years, based on a dental hammer, but it allows me to be very specific about where I adjust, but it's also an analysis technique. So all the adjustments are done with the patient face down on a larger table than usual. There's no twisting, popping, cracking, people that are worried about being in uncomfortable positions. Very specific about where it adjusts, and it's actually the most researched chiropractic technique out there, even going to the point where it has meta-analysis.
I like it because it doesn't create a lot of discomfort.
No, it seems to make less pain after the adjustment. The recovery's faster.
Yeah, I find that over the years, people have complained to me a lot. You know, I went to so-and-so down the street and it seemed to help, but it hurt. And I like the activator because it doesn't. How long does it take to learn how to use that activator?
Oh, not long at all. A doctor probably doing 25 or 50 patients could become very adept at the basic technique.
And one of the things I like about it as well, and something that you're going to like about it as well, is that a lot of the testing when using the activator is done with neuromuscular biofeedback technique. So we're doing leg checks, we're doing leg lengths rather than deltoid muscle tests, but it's the same. We're querying the subconscious or the innate intelligence to determine what needs to be fixed, how it needs to be fixed, when it needs to be fixed. So it's very, very, very precise.
And it's very good at avoiding over-adjusting, and that's when people get sore.
That's when people get sore. Probably the second most important area, and something that drew me to your office, was the hyperbaric oxygen. Tell us a little, what is hyperbaric oxygen?
Hyperbaric oxygen is the use of more than one atmosphere of pressure to help push more oxygen into the body. Oxygen is the ultimate receiver of electrons that help us create energy. So if you create an unlimited amount of oxygen in the body, you can create unlimited healing.
How do you do that?
Well, you put a person in a chamber. I use a mild chamber. It's like a large, about the size of a pup tent. And there's a mattress in there, and the person lies down. They can take a nap, they can read a book, they can watch a video, because I'm not using 100% oxygen like the big chambers at the hospitals. And it's very relaxing. I can even take a nap in there, and I call it a super nap, because 1 hour of that's about the equivalent of 3 or 4 hours of rest. Really turns on that parasympathetic healing response.
Who would you recommend for hyperbaric oxygen treatments?
Well, first off, any type of chiropractic patient with musculoskeletal pain, any athlete with pain from overworking, It increases their endurance. You'll see that there are a number of professional athletes that have their own mild hyperbaric chambers now. Professional football players, golfers, many specialties. But the place where I like to use it is for neurological injuries. We find that head injuries, concussions, peripheral neuropathies, even things like Parkinson's and Alzheimer's respond to extra oxygen into the brain and increase healing.
Brain disorders.
Mm-hmm.
So we're looking at everything from autistic spectrum challenges with our children
Absolutely.
all the way up through dementias in adulthood.
Mm-hmm.
That's an amazing range. But again, oxygen is critical
Absolutely.
for the manufacture of energy in the body. No energy, no healing. And most people who are ill don't move, don't breathe, don't exercise, don't get enough oxygen, and so they don't heal well. So I can see where hyperbaric oxygen is going to end up being an incredibly useful and appealing modality to bring into the system.
And when you use the mild chambers, it can also be very cost effective because the cost of running a chamber is minimal. It's just the electricity for the pumps. We're not using liquid oxygen, so we don't have the increased cost or flammability of that. And there could be centers on every corner.
Yeah, safety is a big issue, and convenience is a big issue. You do some technique called myofascial release therapy as well, and a lot of people do that. But there are different types of myofascial release therapy, and I've been fascinated by the type that you use because I hadn't seen it before. You brought it into our office.
Oh, well,
Tell us
thanks.
a little bit about that.
Well, it's just the use of a Chinese tool called a gua sha. There are other techniques in chiropractic that use thumbs and fingers and other tools that are stainless steel. This is a very simple tool. I take it and I rub over the area where there seems to be gristle or some kind of binding of muscle to muscle or muscle to skin where there's been an old injury and the tissues are tied up. They're tied together when the body healed it. I use a rub that I apply with it, rub over the area in several directions, and I see a reaction come up and can actually see the areas that have been tied down together.
That's what surprised me. It becomes very, very visually obvious
Absolutely.
that something's taking place there.
Absolutely. And then on top of that, I use a cold laser on the places that have come up with the most reaction to try to speed the healing and to carry the rub that I use down into the tissue to speed the healing.
So basically what you're hearing is that the essential care centers have moved into a space of advanced scientific chiropractic approach and theories and are bringing the very, very latest to patient care by adding this to our overall programs. I think that for those of you who are watching and looking to add a chiropractic physician to your family group, to your family health advisory group, this is going to be a real added benefit. And we're delighted to bring it to you, and we'll see you next time.